Welcome to the Senior Moments Podcast, brought to you by SCAN, the Senior Citizens Activities Network, and our friends at New Jersey Natural Gas and the Save Green Project. Good afternoon, everyone. My name is Mike Ciavolino, Executive Director here at SCAN, joined each and every week by my co-host and colleague, the lovely and talented Communications Director here at SCAN, Ms. Andrea Tarr.
Hi, everyone.
How are you?
Mike. I'm good.
What's shaking? How was your week? It's Friday, as you know, in the summer. It's about 1,000 degrees out there, but we're nice and cool in the basement.
But it's like 55 degrees in the office.
I know. I might live down here this weekend.
Yeah, it's something is wrong. Something is wrong. But yeah, you know, we're kind of getting, we're coming to the end of our semester.
Yeah. What a great semester it's been.
It's been
a lot of highlights.
Packed, absolutely, but now we're getting ready for golf.
Yes, golf outing July 15th, speaking of hot days.
Coming up, probably the hottest day.
More like an endurance contest for our members.
It is. Stay hydrated.
Yes.
But otherwise, we're just busy in general, which is a good thing.
A lot going on. But, at the outset of every show, I always mention New Jersey Natural Gas because they're one of our founders and one of our sponsors. But, really, I was thinking about it today. We need to thank all of our sponsors for everything that they do for us. And, among them are two amazing guests that we have today. How about that for a lousy segment? Do you like that?
Not bad, not bad.
Please welcome to the show, ladies and gentlemen. They're here to talk about the Parkinson's program at Encompass Health and Rehab of Tinton Falls.
Who is a sponsor, Encompass.
Who's a wonderful sponsor of ours. Thank you so much. Please welcome to the show, ladies and gentlemen, Marjorie Toron, who's wearing a very cool T-shirt. She's going to tell us all about that. And Brooke Quigley. Welcome, ladies. How are you?
Thank you so much for having us.
Happy Friday. Happy summer.
Yes. Yeah, happy to be here.
So for our members and listeners and viewers who maybe aren't that familiar with Encompass Health, why don't you just start by telling folks a little bit about you guys.
Okay. So Encompass Health is an inpatient rehab facility. So our patients either come from the hospital or sometimes from the community. It's an intensive type rehab setting. So it's 3 hours of therapy, 5 days a week, really intensive and meant to get you back on your feet. We have 60 beds and a very vibrant, exciting therapy gym. Yeah. And it's really exciting and a good place to be.
I'll tell you, I had the opportunity to come over and meet with Beth Sarfati, your CEO, recently. And I was blown away by your place. It's just so beautiful.
Beautiful facility.
And well lit and clean and lovely. So if you haven't seen it, folks, and if you have a loved one or know someone, you should really check it out.
Like, it didn't feel like a clinical environment.
Yeah.
It's really just if you have to be there, nobody wants to be there.
Yeah, of course.
But it is a beautiful place.
Yeah. It is. And it's fun. I mean, we have a lot of fun there.
We have a lot of fun, and we're like a family there. So especially because we could speak for the therapy team, when we're down in the gym, no matter who you're treating, who you're working with, you could see other people working just as hard. And whether it's the patients talking to each other or the therapist, we have a lot of fun.
Well, that's a good thing.
We get people back on their feet.
Yeah.
Wonderful. And that's what we all want ultimately, right? And so among your many specialties that you excel in at your place, among them is Parkinson's, which we know you're both deeply passionate about. So why don't you talk a little bit about the program, how you both came to join it, and a little bit about your day-to-day there.
Absolutely. Okay. So I am a speech pathologist by background. I've been at Encompass for about 5.5 years now, and I've been the manager of the Parkinson's program for 4 of them.
Wow.
So the point of our entire program is really to provide a certain standard of care for these patients with Parkinson's disease. So when they come in, they know that their therapists are trained in working with people with Parkinson's disease.
Yeah.
We will tailor their exercise program, their training, to ensure that it's really for their diagnosis, because it does differ,
That's what I was going to say. Now, it's like many diseases, it's a spectrum where folks are. So
absolutely.
I guess whether it's you're seeing someone at the onset, where it's got to be a frightening, overwhelming time, to somebody who's had it for a while.
Sure.
I guess you see all that.
We do. Actually, we will get patients that come in for an unrelated reason. Let's even just say a hip fracture. Yeah. And then some of the therapists might initially even notice some signs of Parkinson's. So sometimes they're first getting their initial working diagnosis there, meaning, it looks like we might have Parkinson's. We're going to try some medication. Please follow up with your neurologist as an outpatient. But then on the other side of it, we have patients that are late stage, end stage Parkinson's disease that have been diagnosed as early onset in their 40s. Wow. So we see the entire continuum, and we are prepared to work with every step of the way.
Yes.
So you mentioned signs and symptoms. For someone who is coming in for a hip fracture or just has something completely unrelated or may feel well in other ways, what are some things that folks should be mindful of or look out for?
Yeah, that's a great question, because I think some of the viewers at home or just anyone, the thing about Parkinson's is it's typically diagnosed in the 6th decade of life and beyond. So we're looking at people that are in 60 and above. The first sign of Parkinson's people typically notice, would be a tremor on one side of the body. And it's inconsistent and it's asymmetrical. Usually to start, you'll notice it on one side. And that's typically my patients say that was the first thing they noticed.
Like a hand or?
Hand, yeah, that's typical. There's something called a pill rolling tremor. It kind of looks like this. And that could be a way it starts. It's Parkinson's affects everyone so differently. But I've heard a lot of that. And one sign of Parkinson's that most people will experience is called rigidity. It's stiffness in the body. Not just like stiffness with age. It's a lot more marked than that.
Yeah.
So those would be the two main things that my patients have noticed. I don't know if you've had anyone else kind of...
Yeah, I think especially for us, like the rigidity, and also people say shuffling of their feet or festinating gait. So a lot of times that's what family members might see too, is that it's instead of our normal larger movements that we do from day to day, it's quick shuffling movements. And then like she said, a lot of the rigidity and slower movements. Those
But
are
is that something that's like, just for clarity?
Yeah.
Maybe you're seated for a long time. You get up, you're stiff. That's not what we're talking about.
That's typical. This is like a pretty persistent stiffness that happens
throughout the
exactly more than just that initial.
It's not normal.
Yes.
There's something going on.
But that's what's tough, is that some of the signs of Parkinson's overlap with signs of aging. So it's a matter of being aware of your body and kind of noticing some of these things. Like, I'm noticing I'm much more stiff than I was. That would be a time to talk to your primary, and they would help to.
A loss of feeling, is it?
More so just, they call it a pill rolling tremor because it kind of looks like this with the fingers. So a tremor, of course, not a sign of aging. That would be more so, more of a red flag, but the rigidity, the stiffness, that sometimes is confused with typical signs of aging.
I see.
And it seems like, we've had talks here on Lunch and Learns regarding Parkinson's, and something that I've observed is that a lot of people really know nothing about it. They don't know those that are potential symptoms.
Yeah.
So you might just think, oh, I'm a little stiff, but it's more than that.
Yeah.
You do need to be very aware of your body.
Yeah, and that's kind of part of our community
Make sure you
outreach
talk
too.
to your
Is
doctor.
yes,
Yeah.
is to make sure
Education.
it's education for the
Education,
community.
so
And I guess not
Yeah.
only of seniors, but the children,
Right.
adult children.
Because they might
Absolutely.
notice it more.
Right.
That's a good
Like
point.
mom or dad, what's going
Walking
on.
slower.
We don't
yeah.
always notice things in ourselves.
Or do we
right?
want to notice them? Like, I'm
That's
not
true.
even
Fair.
dealing with
That's
that.
right, denial.
And
That's
sometimes
good.
we have to remind ourselves of that too, because this is our world. So we look at this stuff on a day to day
Yeah.
with our patients. So sometimes we don't realize how, we do have to educate people on it, because they need to look for these signs as well.
Yeah. Yeah.
So-
definitely.
So, okay, so you're a speech language pathologist by
Yes,
trade, and
I
now
am.
you're manager.
I am the manager of the Parkinson's program.
And Marjorie, I can tell by your very colorful
I
t-shirt
know.
there. Would you tell the folks at home a little bit about that shirt?
Yes, so I am an occupational therapist. So on Fridays at Encompass Health, we are allowed to have our dress down days.
I hope we're not keeping you from
No. Fridays are fun at Encompass, but we have our dress down days. So the therapy team, we got matching shirts. So it has therapy squad, OT, PT, and speech on here. A little bit of equipment that each of us will
Love
use.
it.
But it's really fun. The patients like it, and it's kind of a way to, just have fun and show
Switch it
unity
up.
at work.
Yes.
Yeah.
Brings the equipment to life a little bit.
Yes.
Probably
100%.
disarms your patients. It's got to be a very scary
Oh.
time to be there.
Yeah.
and-
100%. So as an occupational therapist, what I really focus on is getting my patients back to functioning in day-to-day life. So I'm looking at their day-to-day activities. On a basic level, it's just getting out of bed, getting dressed, going to the bathroom, things that we take for granted. Parkinson's is a movement disorder, so there's a disconnect from what their body wants them, from what their mind wants them to do, to what their body's able to do. So I want to see what is the best, safest way that I can promote them being independent in those day-to-day
Is
tasks.
there something that causes Parkinson's, or is it just genetic, or
So it's tough.
especially when it doesn't appear, like you were saying, until you're in your 60s or
Yep.
beyond?
And I remember asking you that very
Yes.
specifically. Was there a lifestyle component? But
Yes. So most cases are considered idiopathic, meaning there is no known cause. However, there have been some there is some kind of signs. So there are some genes that when mutated increase your risk for Parkinson's disease. There's also environmental factors, so increased exposure to certain pesticides could increase your risk.
All of us.
I know. And
That's scary.
It is, and that's what's tough, because you don't always know what you're being exposed to. Repetitive head injuries, like those that played maybe a contact sport, puts you at more risk for Parkinson's
Muhammad
disease.
Ali.
Yes. Yes.
What was I just? It's more common in men. Sorry.
Yeah.
And it's an age. Age is a risk factor. Just because I discussed it, really is usually after a certain age that you're diagnosed. The cause of Parkinson's, I know that's kind of what I usually get into next, is that there's a certain area of the brain. It's called the basal ganglia, and what happens is there's like cell death in this area of certain neurotransmitters that control movement. So anything that your body does that requires movement, which is basically everything, right, is impacted by Parkinson's disease. We don't know why exactly these cells begin to die. And Parkinson's doesn't usually actually even present physically until 80% of the cells have died.
Wow.
Which is why we're really working as a field, not me specifically, but in general, to try to find earlier detection so that we can begin treatment before we're at 80% cell death.
So, to that point, what have we as a field learned about the disease in your time that you've been, like the last 5 years or so?
So one of the biggest things that came out about maybe last year that I noticed was they found a new, so the problem with Parkinson's, I should say, is that it's typically diagnosed clinically. You go to your doctor, here's my symptoms. They'll usually send you to a neurologist or a movement disorder specialist. They see your symptoms and they're going to say, this seems like Parkinson's disease. And usually the first treatment would be, let's try medication. And if it works, well, then we're treating the right thing. So it's really very clinically diagnosed, which is tough. And I'll have patients say, I don't even think I have Parkinson's. And sometimes they're like, well, you might be right. Because it's a working diagnosis.
Because if the medication works, you probably do.
Yeah. And if it doesn't, it's like, well, now what?
Yeah.
So there is newer research where they found a biomarker that's in the spinal fluid, so they can pull spinal fluid and test it, and they can essentially find a certain protein that would show Parkinson's, and this could even be in people that are not yet diagnosed.
It is incurable?
It is incurable.
Sadly, yeah.
It's incurable, but it is treatable.
Yes.
Okay, so let's talk about that for a second. You guys referenced some treatment for Parkinson's that include medication, that include lifestyle changes.
Exercise, moving, right?
Yes.
That's where Marge comes in.
Talk about that and what kind of plan you'd put in place. Let's say someone comes in there. I guess everybody's different, but generally speaking, how would you approach a patient?
So I'm going to talk about the movement first before we get into the medication, but I always tell my patients who have Parkinson's that exercise is medicine. Your movement is medicine.
For all of us,
yes,
right?
for all of us, but especially people who have Parkinson's disease. So the more that we can get them on an exercise regimen and an exercise program and get them moving in all directions, the better their symptoms will be. So like I said before, yes, we don't have the means to cure it, but we can treat it. So from day to day, as a therapist, what I look at is if someone's having difficulty with their basic day-to-day mobility tasks, like what about getting out of bed, getting on and off the toilet, or just standing up, I'm looking at the symptoms that they have of Parkinson's, whether it's bradykinesia, which is more of a slow movement, if they have bradykinesia, so a slower movement. So if they are doing smaller movements, we're looking at that rigidity, that overall stiffness that they have. So as a therapist, what I want to do is promote large movements. So we increase the amplitude of the movement. So
so potentially someone could do, I don't know, like yoga or
yes.
go for a walk or...
100%. So big movement. So when we think about how someone might just try to stand up, if it's really difficult, if they're stiff and kind of back in themselves, I want them to take those bigger movements, working on their weight shifting to get up and expand their chest, because maybe throughout the day they're like this, right? They're stuck in this position. So I want them to do the opposite. The most important thing is also movement in all directions. So in life, when we're sleeping, we're lying down, but then we stand. We're on our stomachs, we're moving. So again, at Encompass, maybe we don't have the means at that point, if they have other diagnoses on top of it, to get them in every single position.
I guess is probably the case a lot of times.
Yeah.
I see multiple things.
A lot of times once they leave us and maybe go on to home therapy and outpatient, they could really move in all positions all over, and you could really push them to that point. But the two types of therapy that we want to look at is aerobic activity and then skill-based therapy. So aerobic activity meaning like we get them on a bike, we get them, we have something called a new step. We don't have a treadmill at our location, but treadmill training is also a part of aerobic endurance. And we're looking at their heart rate. We actually want to create an intense workout so that they feel that we are maximizing their heart rate throughout. So that's
even walking.
Walking, great. So that's one component of what we're looking at for my treatment with Parkinson's. And then skill-based meaning, like what I said before, we're working on those symptoms of bradykinesia, of increasing flexibility, getting them walking, doing functional tasks day to day so that they can carry it over in their day-to-day skills.
You're listening to and watching the Senior Moments podcast here at SCAN. Our guest today is our friends from Encompass Health, Brooke and Marjorie, who run the Parkinson's program at Encompass Health. So you said at the outset it's not curable, right, or earlier. So at what point then would a Parkinson's patient leave you guys to go on to something else, whether it's in-home or
so
what would the next step be?
So that's a good question. So, and everyone leaves at a different, ability level.
Yeah.
So our goal is to get people as independent as we can safely. We provide caregiver training. We provide equipment kind of training. We'll do home visits. I mean,
caregiver to family members.
Whoever's going to be caring for that patient, So sometimes it is a hired aide, let's say, and they'll come into our facility. The therapists do a really wonderful job of meeting the patients where they're at. Like I said, they will go to your home with the patient, assess the home, and make sure it's going to be safe for discharge. So that's huge.
And also just teaching caregivers and family members the tips that we know as therapists, what works. I've done family trainings where I'm showing them everything that I would do in a session. And I'm going to say, you can do this at home. Let me get rid of all the equipment that we could use. Get rid of it. Let's just use what you have in your home. Right, and I'm going to teach it to you.
Yeah.
Because this is a disease that, that is progressive. So it's something that you want their caregivers and loved ones to know how to care for as well.
Absolutely. And most of our patients, I would say almost all of them, will go home from our location. And
after about how long?
10 to 14 days.
Yeah.
Really?
Yes, it is a shorter stay and it's intensive. It's like a quick burst of therapy. When they leave us, they'll go home and they will have almost always caregivers and therapy that comes to the home to start to help with the transition back to the community. And our case management team is wonderful and gets everything set up for you. So when you go home, you feel good. Everything has been taken care of. They cover every base.
So how can folks, after they've been discharged from you, keep up with that same level of activity that you've put in place for them to help them along the way?
We provide our patients with a home exercise program that they can go home with. So that's like a starting point for them, and then their home care therapist could take over from that point. But really having community resources and continuing with outpatient therapy, once you're past the point of home therapy, you can move on to outpatient out in the community, and also different classes that you could take. For example, like we have power moves, which is Parkinson's wellness recovery moves. I'm certified in that. So I incorporate that into my treatment sessions at Encompass, but also educate my patients and families to continue with it outside. Right. Rock steady boxing, dance for Parkinson's. There's so many community resources, and also just to educate them on the importance of exercise. Once they're at the point where they can go into the community, where family members can either take them or they can go themselves, to continue with that because of how important it is to reduce the symptoms of this disease.
Absolutely.
I'm thinking that, just listening, I'm thinking that there's probably a lot of depression associated, right?
Good point.
Yeah.
Because you're sort of losing pieces of your life slowly, not even quickly.
Yeah, there's very high incidences of depression. We need to be really sensitive to screening for depression. That is something that we do in our facility as well for all patients, but we are highly sensitive to this. depression and anxiety. And then there's a part
And
of
the family,
Parkinson's.
too.
Right.
100%. So Parkinson's has motor and non-motor symptoms, and a non-motor symptom has to do with, sometimes people with Parkinson's present with a flat affect. You'll notice that they seem a little bit disengaged. Facial expressions are diminished, and that's all because that requires movement. It's not conscious, but so it's just this reduced facial movements and reduced, it seems like a very flat kind of affect, like I said.
Yeah.
That can appear like depression as well. So even if they're not experiencing it, sometimes it seems like that.
Just the look.
Exactly.
Yeah.
Exactly. So that's why we need to be even more sensitive, though, to be able to kind of tease out what is depression and what is this kind of flat affect, masked faces, they call that. So there's a lot to have to do with that.
Yeah.
How is it typically diagnosed?
It's typically clinically. You'll go see your neurologist. They'll do some tests. They're going to want to look at your.
But
your walking.
so the visit to the neurologist, is this sparked by an outward
Sorry,
sign
yes.
that someone,
It's usually.
hey, there's something
Yeah.
amiss here?
Yeah.
It's usually, I would say, like someone's children saying, "Mom,
Yeah,
Dad,"
yeah.
like, okay, we're really seeing
You
this.
observe something, or maybe if you're self-aware, you're noticing, and then you go to your primary doctor.
Exactly.
and
So
then-
it almost always
Yeah.
starts with primary, unless someone's already followed by a neurologist for other reasons. But typically, it's primary to neurologist and sometimes a movement disorder specialist, which it is a neurologist
and then to
too.
you guys for
And then,
initial.
And then, so that's kind of what we're trying to get is more people coming from home. So to avoid the hospitalization, we have a direct admission program from home.
That's wonderful.
If you're becoming debilitated, if there's a diagnosis that would qualify, we want to prevent a hospitalization. Let's get you in for therapy
which is what's needed, right?
Exactly.
At this,
100%.
For this type of diagnosis, we really need to be like up on it and not let it get too bad. We want to help you at the start.
So one thing that really shows through to Andrea and myself here is both of your passion for what
Definitely.
you do.
Yeah.
So maybe you could talk a little bit about why this is so meaningful to you, how you got into it, and
Like why Parkinson's? There's so many.
Yeah,
ways
you go
could
first. I'll go.
Sure. So like I said, I'm a speech pathologist, and I see all different types of patients at Encompass and in my prior experience too. And for some reason, I really connect with my patients with Parkinson's. And I think that came from me taking a course in it, and I kind of started to understand it better. And the lack of understanding about Parkinson's makes me more passionate because I like to teach people about it, and I really like to teach people with Parkinson's all about the other symptoms, all about some of the symptoms people don't want to talk about. There's not everything's just the most obvious physical ones. There's other signs of Parkinson's affecting depression, sexual health, incontinence. There's all these areas, and I'm trying to talk about it more so people feel more comfortable knowing you're not alone. This is part of the disease, and we could talk about these things. So I have a passion for educating, and I like my patients with Parkinson's because I think a lot of people see the flat affect, don't engage as much, and I just love to have a good time with them because they're still themselves.
Oh, yeah.
Yes, we have a good time. So then just slowly but surely, I've kind of started to specialize a bit in this, and my passion just continues to grow. It's really, I'm very interested.
Now,
That's a good thing.
Yes.
That's a good thing.
how often does your sort of background of speech language pathology come into play with Parkinson's patient? Is that something that's typically, because you don't think of that as being
No,
affected?
So-
you don't.
okay, so that's where I
everyone
come
knows the tremor. That would be the
Yeah.
first thing you would think of, but a lot
Okay.
of people might not
So
understand.
that's where it comes in. So everyone with Parkinson's really needs PT, OT, so physical therapy, occupational therapy,
Right on the shirt.
Speech
and
therapy.
Ladies and
speech
gentlemen.
therapy.
Speech therapy.
Please see the diagram. So speech therapy is very important. The areas of Parkinson's that can impact a person where speech comes in are in swallowing. So that's something that
Oh my
wasn't
goodness.
mentioned. I know. So this is a big one, and again, not something that people talk about as much, but the musculature involved with swallowing will change with the disease. And about 80% of people with Parkinson's will eventually pass away from aspiration pneumonia related to issues with swallowing.
Wow.
That's kind of, so it doesn't happen to everyone. It doesn't happen usually early on, but eventually swallowing may be addressed. The other area is cognition, memory, thinking, problem solving. Parkinson's, again, not for everyone, but it can really impact someone's cognition. And then the last thing would be the voice. So people with Parkinson's tend to have a very soft voice. That's related to movement, involved. So Speech therapists are highly involved in people with Parkinson's, but I think it's a little bit less known.
Yeah.
Right.
Because
Oh,
the
yes.
obvious
Yeah.
things are not.
100%.
Yep.
Yeah.
Sure.
So that's where I come in, and I'm trained in something called Speak Out, which is a voice treatment similar to LSVT Loud. So, a little bit less known, but a huge part in it too.
Wonderful.
Yeah.
That's great. Marjorie?
So my desire to work with patients with Parkinson's actually stems from my dancing background. So yes.
Continue.
Right.
It's
So
actually better than any question I was going to ask you.
Yeah.
So, yes, I'm an occupational therapist, but I've been dancing since I was 4. And when I found out how movement and music correlate to my treatment with Parkinson's, I was sold.
Why don't you talk about that a little
Yes.
bit? The
Because
movement
we
and music.
danced at our lunch and learn.
Yes.
Sorry, I missed
It was
that.
a good time.
So, cueing, different rhythmic cues are helpful to aid in movement for patients who have Parkinson's. So, whether that's just a metronome, where it's a simple,
Does everyone, yeah.
Yes.
that, or if it's me.
That was an impression of a
Thank you,
man.
yes.
That was excellent.
Thank you, I'll be here all night. Or snapping as we're walking. But what I found is music and having the beat of the music to different functional day-to-day activities is so beneficial for someone who has
So this
Parkinson's.
is something you're doing with your patients?
Yes, I make my
weekly.
patients dance. Yes, I will always get people up and moving because movement is medicine. So whether you have Parkinson's or whether for anyone really, just getting you up on your feet, music is fun. Music connects, you to the person next to you because if you have the similar song choices. You can do it from sitting down, you can do it from standing up. It could be graded different ways, but the point is you're moving, you have a cue, a rhythmic cue to work on the speed of movement, the quality of movement, big movement. So what better way than to dance?
None,
Yeah.
none that I could think of.
Now, Hilda Gordon.
Yes.
Okay. And she's
Tell
she
Marjorie and
she
Brooke
was
about
there.
Hilda.
She
Oh,
was
she was there.
She was there. And because Hilda is, I want to say she
100.
might be, she's 100.
Wow.
She was dancing.
Yeah.
She was dancing.
She
And
has the square dancing symbol on her license plate,
Oh
by
my
the way.
gosh.
So
She's unbelievable. But she was right in there. And Natalie Braun, who uses a walker,
Yeah.
she's very, very difficult to move around. She was dancing. So, I mean, the point of it is music, it gets you. It
Oh,
gets you
100%. Actually, every Friday at Encompass, so later today, I do we call it the Friday dance party, but it's movement and music. So for 30 minutes in the gym, you're with your therapist. I lead pretty much different dance moves and different songs. We'll always start off with the YMCA. And
oh my goodness! What
and
time should we be there?
2:30.
Come on over, it's 2:30.
So
I'll
fun.
be the cop.
But the therapist, if they're working with a
He and
patient,
Andrea.
will gear what I'm doing and either upgrade it or downgrade it based for the patient level. Now, this is for anyone, not just with Parkinson's. Anyone who's down in the gym at that time, we'll try to schedule the people who would like it the most. But let me tell you, I've been so surprised. There are some people that I'm down there, I'm like, oh, I'm interrupting their therapy. They're not going to want me to. They get up, their arms are YMCA.
Yeah.
They are dancing, they're standing. So it's my favorite thing.
Even, it's exercise disguised as dance.
Exactly.
Right? So, and even, at our lunch and learn, we have some hardcore people who don't do anything, but everybody participates.
Everybody was
We were
dancing.
nervous about that when I was
know,
like, they don't know,
I know.
but they're about to start dancing. Oh,
Did you
that
play
one.
YMCA that
Oh, we
day?
did.
Of
YMCA.
course.
But you have to see the therapy gym. I mean, you've never. It is really exhilarating, and I've even been in there as a speech pathologist, and we're working on. Do you remember the lyrics? Do you know this song?
Yeah.
Can you follow the commands and the steps that she's showing? So everyone benefits from it. Everyone is happy, joyous. It's really in a time of your life when it's probably not the best. If you're in rehab,
Yes.
you're not having the best time. It brings this joy. I mean, really,
Yeah.
it's the best.
And
It's
it
the
brings
best.
the joy to the
Feel good
therapist,
about
too.
yourself, and
Absolutely.
I
And-
can do this.
100%.
And connected
You
through
probably
music,
love
it's
it
just
as
great.
well.
Oh, she loves it.
I love it.
Yeah.
I'm
I
like,
mean, we were watching you, and Mary Beth and I were like, she loves this.
Yeah.
You could see it. You could
if
see it.
if I'm dancing, I'm happy.
But
so-
you
Yeah.
brought joy to the whole room.
And
It was great.
And what's clear is that you bring joy to your patients too, and having
Mm-hmm.
a positive outlook and attitude towards things that affect us as we get older means everything
Yeah.
to living a happy and healthy life, and you guys go a long way towards helping patients with that. So
Because we want to be
Kudos to the great
optimistic
work
that
that
at
you
some
do.
point
Thank you.
there'll be
really,
I don't know if the word is even a cure, but it'll be a lot easier to live with Parkinson's,
Yes.
hopefully.
Exactly.
So as we wrap up here, why don't you tell folks how they could get in touch with you, or a loved one could get in touch with you guys? You can give the website or
Sure.
a phone number.
Yeah, so if you go on encompasshealth.com, it's going to lead you to all of the hospitals in the system, but we are Encompass Health of Tinton Falls. If you look us up, to give a call, whatever number you get, they will connect you to the right person. That's what I can say.
And please send us a video of the dance thing later today. We'll put it on our Facebook page.
We
Yeah,
will.
Please
Yes,
do that.
it's you got to come. You really should come one time.
2:30
It's
on
wonderful.
Friday.
2:30 on
Okay.
Fridays. It's a good time.
Bring mimosas.
Yes,
We're
exactly.
not busy.
Yeah. No. Well, listen, Marjorie, Toron, Brooke Quigley from Encompass Health and Rehab of Tinton Falls, we thank you so much for being on the show
Thank you.
today and dropping all this knowledge for our listeners and viewers. It's obviously something that's critically important. So get in touch with them, folks. If you have a loved one, or even if you think you just, somebody has an issue, the sooner you get in touch with these guys, the better. That's all for today, folks. We thank our guests for being on the show. Thanks to New Jersey Natural Gas and the Save Green Project. Thanks to our Crack TV class for getting it done again today. And Robin Kemp, our TV production instructor. My name's Mike Ciavolino.
I'm Andrea Tarr.
And we'll see you next time on the Senior Moments Podcast.